Adaya, how are you?
Na bhavana andariki namaskaram.
Namaste, and congratulate you for being the lead in the project. Thank you.
No, thank you very much.
Which districts you have selected and centers? Already Bhadrachalam, I think it got BPN accreditation.
Bhadrachalam, I doubt it, sir. Bhadrachalam SNC accreditation ayindi.
SNC.
BPNI gaలేదు.
Okay.
And I think no SNC has got accredited for BPNI till date in our state.
Yes. I think that will be a first and great to begin, you know.
Yeah, we should all pull up our socks to get it done.
Yes.
So Coach Bhaskar sir, are we good to start? We are hosting.
Yeah.
Good to start. Yeah, I'll just change the setting to mute. You all, only the faculty are here, so you can unmute yourself when right. Namaskaram everyone, and a warm welcome on behalf of Indian Academy of Pediatrics Twin Cities branch to this particular launch event and theme talk on the occasion of World Breastfeeding Week 2022. Breastfeeding is part of our IAPTCB's 2022 Presidential Action Plan, and it's a privilege for us, EB members and me as the secretary, to take this Presidential Action Plan forward. And we have a wonderful week ahead with a lot of advocacy activities, with a full week talking about breastfeeding and also taking things to action. And this particular launch event is meant to release the advocacy material and also seek wishes from all the dignitaries of IAP. We're very privileged that our President of Indian Academy of Pediatrics, Dr. Ramesh Kumar, is joining us as the chief guest, and Dr. Salima Bhatia, UNICEF health specialist, is joining us as guest of honor. Thank you, distinguished guests. I'll now request Dr. Coach Bhaskar, the President of IAP Twin Cities branch, to give his inaugural remarks. Dr. Bhaskar, sir, please. Bhaskar, sir, you need to unmute.
Yeah, thank you, Dr. RSV. Respected participants, our Central Zone Vice President, Dr. K. Radhakrishna Garu, and our President, Telangana State, Dr. Akila Bhaskar Garu, and Secretary, Dr. Pawan, and as well Dr. Salima Bhatia from UNICEF, and our pride regarding SNCU, Dr. Damare Yade Garu, Dr. Keshavlu, Dr. Arun Gupta ji. I welcome you all to this inaugural curtain raiser program of World Breastfeeding Week, and this is very, very close to our entire EB team of promoting it. Therefore, we have 7 days programs. Every day we have a program. Like on 1st August, we have parent awareness mission at Paramita Hospital. On 2nd August, we have a national webinar on breastfeeding. On 3rd August, we have a CME exclusively for practitioners about breastfeeding at Vijayameri Hospital. On 4th August, nurses, they are very, very important paramedical staff in promoting breastfeeds. So we have a practitioners, nurses quiz at Apollo Medical College under the stewardship of Dr. Sri Krishna at Apollo. And as well, our main partners in promoting breastfeed, they are obstetricians. During their antenatal checkup, if they say one word to the mothers, that goes a long way in fixing mothers' mind to give exclusive and early breastfeeds. So we have a special event that is connected with obstetrician at Kim's Gardens, Bandapur. And the 6th August is a valedictory, wherein we have a breastfeeding quiz for postgraduates at Nilofer. So we have so many programs, and we are committed to promote this breastfeeding. And we have a good support from our Telangana State EB, very good support from UNICEF, particularly Dr. Salima and Dr. RSV and all the other people. So thank you all for joining us. And my special pronouns to Dr. Arun Gupta for joining us. Thank you. Over to Dr. RS.
Yeah.
Dr. RS, are you available?
Yes, sir. Yes. Just a second. Right. Thank you, Arkal Sunkoch Bhaskar sir, for all the support. I mean, this is possible a scale of this magnitude only because of your leadership and your commitment. That when you celebrate Breastfeeding Week, it's not just on the launch day. And it was his promise that we'll do something for all stakeholders. I can tell you, it's very easy to do something for pediatricians being in IAP, but it's very tough to walk the path with obstetricians, with nurses, with the people in Basti Davakhanas, with the media, with the public. And this is the vision which IAP Twin Cities branch has. And we are very fortunate that we have like-minded people who are ready to join us in this journey. And thanks to also the leadership and the support from IAP Telangana State, I now request Dr. Pawan Kumar, the Secretary of IAP Telangana State, to say a few words. Pawan, please.
Thank you, RSV. As together we used to do a lot of work in breastfeeding last year. That was a champion program what we did during the last breastfeeding week. I think I'm sure that the same is going to happen this week also. And we ensure, because we the ambassadors, we the pediatricians as an ambassadors, we have to a great role to spread the message, promote, support the breastfeeding cause. And that can really reduce the burden, the double burden which our country is really facing. And breastfeeding promotion as a state body, as we're also doing in all districts, motivating everybody on displaying the posters, encouraging parents, because there's low cost affair which can reduce really mortality and morbidity to a greater extent. So state body is really vouched for the cause. And this year theme, we all know that, educate and support, step up for breastfeeding. Who else? The pediatricians and obstetricians joining together can really bring that change and let the momentum continue throughout the year. And we PATS along with TCB are really committed for this cause. And let us plan the program throughout the year. So, and I'm sure that this year state conference, we are going to give a big show and a one day dedicated as a workshop for the lactation management courses and all. So with that intent, I request our president also to give his remarks and start the session.
Thank you, Pawan. Thank you. And it's a promise to Dr. Salima and also the entire team that breastfeeding earlier, we used to literally request repeatedly for a small panel discussion or a talk. Now, it's a promise from Telangana that we'll have a full day workshop only on breastfeeding, and we'll ensure that we close it on a high and hand over to the next body to take things forward. Thank you, Pawan. Now I request our big guidance and a pillar of support for Telangana State, Dr. Arkal Bhaskar sir, President of IAP PATS, to say a few words.
Good afternoon all, and Dr. Sunkoch Bhaskar, President TCB, Dr. RSV Sri Krishna, Secretary, our own Honorary Secretary, Dr. Pawan, our Vice President, Dr. Radhakrishna sir, today's Chief Guest, Dr. Ramesh Kumar sir, our National Central IAP President, Dr. Vikas Bhatia, Guest of Honor, and the UNICEF Chief, Dr. Salima Bhatia, Madam, and also our inspiration and very close friend, Dr. Damar Adaya. So our presidential action plan is to support, to promote, and protect the breastfeeding, to have very good mother and child health and well-being. So in this regard, in this occasion, we are going to celebrate in a big way the breastfeeding week throughout the week. And I congratulate the TCB team for taking this initiative. Coming to the actual situation in the community, only 44 to 48% of infants are being given exclusive breastfeeding for the first 6 months. And the statistics are same for the last 2 decades. On the other hand, the infant food industry is being increasing tremendously from $50 billion in the 1922 of more than $100 billion. It is going to reach within 7 to 10 years. So why so much gap in covering the babies, not getting the full exclusive breastfeeding for 6 months and up to, along with complementary feeding up to 24 months, we have to think over. It's not simply to blame the mothers. We have to take the situation in a holistic way. At the national level, we should have a very positive encouragement environment to support, promote, and protect the breastfeeding by giving free 6 months maternity leave exclusive for to promoting, supporting the breastfeeding, and also at workplaces also, and all the birthing spaces and healthcare facilities. Not only the doctors, the paramedical staff, and nursing staff, they should be educated to go in this way to promote the breastfeeding. And at the community level, not only the mothers, the parents, especially the in-laws and the NGOs, they have to take a big role in promoting the breastfeeding. With these few words, I congratulate all the organizations like UNICEF, WHO, and WABA, and all other international and national organizations who are doing a human service in protecting our children and having going in a positive way to get the breastfeeding by 100%. With these few words, thank you. And I wish all the best for TCB team and congratulate once again for taking this very good initiative. Thank you. I will be there and our team will be there to support. Thank you, Dr. RS.
Thank you, Arkal Bhaskar sir. Thank you for the support, unflinching support as always. Another person who always says yes to whatever I ask is our Vice President. He has the responsibility of 5 states and a small city in like Hyderabad in one corner, always is his favorite. Thank you, Radhakrishna sir. I invite you to say a few words, the Central Zone Vice President of Indian Academy of Pediatrics.
President Ramesh Kumar ji, Bhaskar and Bhaskar, IAP and state presidents, Pawan and RSV, honorary secretaries. The success of Telangana and IAP Twin Cities is always because of a good teamwork. A classical example where their team was very successful was the excellent conduct of Central Zone Conference in the beginning of this month. I must say it went to the standard of a national conference. Only difference was the numbers were 800 or 900 a year. In the national conference, it was huge. So the main success is because of the teamwork. We are very happy that the teamwork is continuing and you are doing all the programs well. Last week, you also did the ORS program very well. This year, the theme of World Breastfeeding Week, Step Up for Breastfeeding, Educate and Support, is a nice theme. And without knowing, the concept of World Breastfeeding Week started 30 years ago in 1992. And this year, we have entered the 40s, that is 31st year of the World Breastfeeding Week celebrations. And individuals, organizations, government should do something to encourage breastfeeding to make it a goal of 100% from 44%. I am sure these weeks, yearly celebrations will boost up the numbers of breastfeeding mothers. Thank you, Arun. Again, I forgot to thank Salima, Arun, then Kesavlu, Yadaya. Thank you.
Thank you, sir. Before I invite Dr. Salima, the context here is that we're taking up a very unique challenge at IAPTCB. We've started a campaign called Breastfeeding First, wherein breastfeeding is the first in our thought and in our action. The first date of every month is devoted for breastfeeding. So it's no more just 1 week in a year, but the first day of every month, so that the momentum which builds up now will sustain itself. The second, we are trying to have the first BPNI accredited private hospital and also the public health facility in Telangana. And I'm not sure if anyone in South or across the country has yet reached the standards. Very tough standards, but we are here to take up such tough challenges. And it begins from home. Our president has committed that his hospital will be taking up the first assessment for BPNI accreditation, and our project lead on newborn QI, Dr. Yadaya, will take it up at Nalgonda. And these are very tough challenges and which will be supported by IAP Twin Cities branch, thanks to the support of UNICEF. and our privilege, Dr. Salima, to have you as our guest of honor. Thank you for the unflinching support all through. And like I get it from the president and vice president, it's never a no from you for any of our initiatives. I request you to please give your special address.
Thank you everyone, and a very warm good afternoon. And I must say it's a privilege and an honor to be here today. Dr. Radhakrishna sir was mentioning and others were mentioning about how things are, what is the theme for the breastfeeding week. And then we had Dr. Bhaskar and others mentioning about where we stand on breastfeeding. But just coming back, I want to focus on one thing over here, and that is the early initiation of breastfeeding. In our state, our early initiation of breastfeeding rates are only 37%. We have 97% institutional deliveries, but only 37% early initiation of breastfeeding. Now, other things may not be in the hands of practitioners, but this is one place where I feel that all of us coming together can make that difference, because the mother is with us and she is very much within our guidance and influence at that point of time. So if we are all coming together at this point to focus on early initiation of breastfeeding, last week, 15 days back, we had Government of India, Dr. Sumita Ghosh here, who was also highlighting how Telangana is one of the worst states when it comes to early initiation of breastfeeding. Now we've gone so much ahead in everything else. And this is one place where I feel we should all come together and make sure that our indicators can improve and go forward. So I'm very happy that during that event, we had a commitment from IAP to take the breastfeeding, early initiation of breastfeeding and BPNI accreditation forward. And more importantly, they also committed to involve the entire range of stakeholders. We had some of you present during that event. We had a couple of partners here, and I would like to actually name some of these partners, because I feel your commitment is going to really make the difference. We have Dr. Pawan, who's committed, and Dr. Bhaskar and Dr. Radhakrishna. Your leaderships are extremely important. And Dr. Sunosh Bhaskar, I remember the first time we met, you said that I want to work on walking the talk. How do we move from just talking about breastfeeding to actually making that step and making that difference? And that is what today we are talking about. That is the theme of the World Breastfeeding Week this time, where we are talking about, what steps can we take to really move towards breastfeeding? And that step begins with 10 commandments, I would say, that WHO and UNICEF put together on what can be done to make a hospital breastfeeding friendly. And then we have our BPNI colleagues who came in and created standards to make sure that these visions get translated into monitorable indicators. So there's accreditation standards, and that BPNI accreditation is what we can aim. So moving from talking about breastfeeding and thinking about breastfeeding to actually walking the talk, that's what today's meet is all about. And like I was saying earlier, I'm really glad. I think AIMS Bibinagar, Dr. Vikas Bhatia sir couldn't make it today, but he has been committing to taking this forward. He has made all his commitments. We also have champions like Dr. Yadaya, of course, whom we can never forget. And we have BPNI who can help us towards the accreditation. We also have partners like Nilofer Hospital here, Dr. Murli Krishna, who is going to be instrumental in taking this forward within the hospital setup of Nilofer, and Suchena Health Foundation. I'm sorry, I'm a little bad with that name. Suchena Health Foundation, Dr. Santosh, who has also been, committing to this cause. We also have our nurses, TNEI, Dr. Rajeshwari here, but more, and ultimately, we also have the Foxians here. I think the fact that obstetricians, pediatricians, neonatologists, nurses, partner organizations. All of us are coming together to commit to this one cause. That's the turning point, and that's the agenda. And I would like to close today's my talk with just one request, slogan, whatever you call it. You remember we had the Each One Teach One campaign by where a lot of organizations came together and committed to teach one child. Now, if we can look at each one, support one, we have so many partners here. If each partner decides today to support one facility to go for BPNI accreditation, and we can have a charter where all of us can sign and commit to this cause, where we can take each one, support one campaign forward, where we commit to actually making sure that at least one facility we mentor, we support, we work with to get BPNI accreditation. I think that's going to be a big challenge and a big achievement for us. And if we can do that, then this year's work would be done, I think, for all of us. So with that one request, I close today. Thank you, everyone.
Thank you, Dr. Salima. And as I said, it's a promise from all of us that we'll walk together and we'll try to achieve. And it's the first is always remembered for a long time. And I'm sure that's a motivation for all of us. It's a challenge for Dr. Yadaya, for Dr. Bhaskar to be the first in the South probably or across the country to achieve the certificate. And this is something we'll cherish for a lifetime. Thank you for all the support. And now it is our proud privilege to have the president of IAP. Whenever you want to scale things up or do something very challenging, and the person whom I request for guidance and support is our president. And amidst his busy schedule, he has promised that he'll be here for just 5 minutes and ensure that this motivation with which we start, it will sustain. Thank you, Ramesh sir. It's a privilege for us to have you amidst your schedule today, and look forward to your remarks as we take up a very, very tough challenge of not just talking about breastfeeding, but also taking it forward. Over to you for your presidential remarks.
Thank you, my dear Sri Krishna. President PATS, Dr. Sungoj Bhaskar, TCB Dr. Sungoj Bhaskar, and the PATS President Dr. Arkala Bhaskar, as well as both secretaries, as we say, Sri Krishna, as well as RSV, Pavan and Pavan Kumar, and my dear Vice President Dr. Radhakrishna. Whereas the stakeholders, the leaders, the keepers, they are the key components, and their key stakeholders are here. Dr. Salima Bhatia, Dr. Arun Gupta from BPNI, and of course from the Dr. Yadaya, and from the FOXI, as well as from the nurses TNA, and my beloved friends in the Indian Academy of Pediatrics. Well, friends, I'm so proud and happy to see that TCB has and Telangana branch has embarked on a different journey this time. We all do have advocacy programs every year, maybe on the breastfeeding front, ORS front, teenage day, everything is being taken up. But then this year has been so different, and the states have been so innovative, the branches. I must congratulate Dr. Sri Krishna, as well as Dr. Sungoj, as well as the PATS team, TCP team, PATS team, for taking something of a different note and bringing together that basically this approach is the multi-sectorial. We are all sure about it. It's not only pediatricians. We need the ground level support when those who go into the community, and we all have to be on the same page when you talk about certain advocacy themes. And on that front, we need always the support from, of course, NNF is always there, IAP is there, then the government organizations there, but we need the FOXI, the Obstetricians Association. We need the nurses, the TNA, Trainers Association. We need BPNA, of course, has been the torchbearer of this concept over the years, BPNA. So naturally, BPNA has been always in the front, and I must congratulate Dr. Arun Gupta for always being on the front. And well, friends, on the positive note, as Dr. Salima has been putting it, maybe the early initiation of breastfeeding out here in Kerala also, I believe we have had a substantial fall in the breastfeeding from the active moves. The early initiation has dropped down a little bit. We have been at the peak maybe 4 or 5 years back, but right now drop has been noticed everywhere. So we need to introspect and where we are losing out, because this is high time. We should not lose the momentum we have captured over the years. That's something which 2015, 2017, 18 were great years for the breastfeeding promotion. Possibly because of the COVID, our activities were a little down, and we are not sure what exactly has happened there. We lost a little bit. Now it's time for us all to work out on this, and these are the days when we can make more awareness across the country and across on all platforms to catch up with what we all learned over this. And on the other side, even from the Indian Academy of Pediatrics, we are also taking very stern initiatives to uphold the IMS Act, I believe, because this is something which has been, I must say, hurting us as an organization. Few of our members have been maybe stretching an olive leaf to, or maybe they are accepting certain to be no, I don't say brand ambassadors, but to be on the list of that Inflamix IMS Act. The industry bans in the IMS Act. And we also recently we have noticed, it has been brought to our attention that few of our members from certain parts of the country have been involved. And IAP as a body has been, the executive board also has recently also reiterated the commitment to IMS Act, and we are trying to push that the warning as well as the punishment for those who have been the punitive measures against those who join with the industry who are being banned in the IMS Act. So on that front, I can say that itself is it's not an easy task taking punitive measures against our own members. But then when pushed to the wall, we certainly will go for it. And Dr. Radhakrishna as a vice president, we certainly will be very sure that we need to go very strongly on that. And I'm sure all our friends will agree for that. So once again, my congratulations to the TCB team, as well as the PATS team, as well as UNICEF. Sri Krishna is very much there, and Salima is there representing UNICEF and BPNA. I'm so happy to have Dr. Arun Gupta here, and all the stalwarts. So let's take this week, multiple activities on. I'm told by Sri Krishna that a lot array of activities are down the line. So with your, I think, with your blessings, I would love to formally launch the week-long celebrations of breastfeeding week celebrations of IAP, Indian Academy of Pediatrics, Twin Cities branch, as well as the Telangana state branch, as well as it's a activity for IAP. So Central IAP is so proud about it, and I hope the involvement or the listening with all the stakeholders is definitely going to make it the desired impact of our activities on all fronts. Congratulations and best wishes to all the team behind it. And Jai IAP, Jai Hind. Thank you.
Thank you. Thank you, President, sir. Thank you for the support, the motivation. It gives us a lot of energy whenever we know that our president is behind us. And as we take up really challenging tasks, and as you have declared it, I'm just sharing what is our plan of action. And as I said, it's one thing to do one event, and it's tougher to do something on that scale for a week, and much tougher when you have to get all partners along and go along with them. So this is what we have planned on behalf of IAP Twin Cities branch. So each day, dedicated time from 2 p.m. to 4 p.m., especially only on breastfeeding. And we are having this launch event and also the theme talk and we'll be sharing copies of the advocacy resources as well. Then the 1st of August, it starts from home, from the President's Hospital, and we'll have interaction with parents, and also Dr. Bhaskar is visiting All India Radio and also Doordarshan, and giving his giving his bites and sharing his experience, so that this will motivate all the pediatricians, and also the message reaches out to the community. We have talks on 5 different media houses, and we'll be doing this through the week. And the 2nd of August, we'll have visits to the postnatal wards. So it's a commitment from all the pediatricians to step out of our ICUs and visit the postnatal wards and discuss with the mothers, tell them about breastfeeding. And we have a special event. This is coordinated by Dr. Yadaya and Dr. Madhusudan at AIMS, wherein we have a national webinar on breastfeeding, a very interesting 2-hour session wherein we'll be sharing experiences. And this is sharing experiences across the countries, across the world, and also experiences from the field. What could we really achieve in the SNCUs, in the KMC ward, so that this can motivate all of us to continue this. And the next is a Nurses Connect Day, a dedicated day to only look at breastfeeding promotion and education of nurses. And when the theme is that we step up and educate, we start with the nurses. So we have poster, slogan, and drawing competitions, where an IAP Twin Cities branch will be rewarding the nurses who have the best poster, the best drawing on the theme of this World Breastfeeding Week. And we have a special nurses CME and a quiz at Apollo Medical College. Thanks to Dr. Sri Krishna sir for taking it up, and request all of you to please join us at Apollo Medical College on the 3rd of August. 4th of August is when we have an outreach activity. We'll be visiting Anganwadi centers, PHCs, and Basti Davakanas. IAP Twin Cities branch will facilitate this for all the pediatricians across the city. Please go down to the Basti Davakanas in the urban areas. Many mothers will be there who are probably in need of this particular information and guidance from all of us. We'll also have afternoon between 2 to 4 a practitioner CME, and this is very much focused on the practitioners who are in clinics. Many a time we see them at 6 weeks, 10 weeks, and even at around 6 months. And these are visits which we should leverage to ensure that they continue breastfeeding and give only exclusive mother's milk till 6 completed months. 5th August, we have Perinatal Connect, wherein we are interacting with obstetricians, sharing stage with them, and talking about breastfeeding along with them. There are a couple of talks by the obstetricians themselves, and a special event, the Perinatal CME at Kim's Cuddles, Kondapur, wherein the obstetricians and the pediatricians will sit together and talk about breastfeeding problems. And this session is very interesting because it is moving away from just the theory. We are trying to solve problems in different case scenarios, and I'm sure all of you who come down to Kim's at Kondapur will enjoy these technical sessions. And the big one is the event on 6th, which is the valedictory event and the most awaited PG quiz. And this PG quiz is, I would say, a way in which you share information and learn. And quiz is the one which is most exciting for all of us. So Dr. Srinivas Murki himself will be doing this quiz for the postgraduates, and our gratitude to the entire team of quiz masters who are DM neonatologists, Dr. Aparna, Dr. Tejo Pratap from Fernandez. So expect high quality technical content in the PG quiz, and I'm keenly looking forward to the quiz along with the valedictory event. Now, Dr. Salima said that there are a couple of very important aspects for us to focus on, and this is what IAP Twin Cities will be taking up. We'll have daily messages to all the IAP members. It's not just for one day, a week-long advocacy campaign on bulk SMS, on WhatsApp, on our Twitter page, Facebook, and also on our YouTube. We'll be wearing badges in support of breastfeeding, and this will be worn by all the office bearers. And it will be written that I'm a breastfeeding champion. So all those 50 to 100 mothers who come and see you wearing that badge will now be assured that they are at a place where the treating doctor is a champion of breastfeeding. We'll have posters at all the clinics and hospitals, an intensive social media campaign on Twitter and Facebook, and 2 very interesting activities. The next issue of IAP Twin Cities Journal, which we usually release in the first week, this issue will be a special issue on breastfeeding. So 30 pages devoted to the latest updates and comments and articles from the best of academicians on the topic of breastfeeding. So a special issue on breastfeeding, and I call it as an action note and not just a concept note, wherein we are going to discuss, deliberate through the week, an expert group which will sit down and talk about how do you specifically improve breastfeeding in C-section. And this is a commitment from us that we will release this action document on the valedictory event on the 6th of August. And we'll have a group of academicians and committed practitioners who will sit on this document and come up with a very crisp 8 to 10 pager. And I'm hopeful, Dr. Salima, that this is going to take the agenda of improving breastfeeding in C-section forward. I've also kind of put up a challenge to Dr. Yadia saying, let us not just limit it to the concept note, let us show it at one of the units. If one of the units can demonstrate how you can breastfeed on the labor table in the OT, then that is where the success lies. And once we do it, and I'm sure we'll have more followers. We've done it in the past where in kangaroo mother care, we started like that when people were wondering, how will it even work? How will it save newborns? And now we have the country's largest KMC ward in Telangana and also the largest number of KMC beds in our state. I'm sure this is a challenge we'll take up now and which will give us a lot of dividends in the times ahead. So this is just a glimpse. Request all of you to please join us as we have a week of celebrations and across all hospitals, across all settings, right from KIMS Hospital, a tertiary care facility to the Basti Davakanas, reaching out to nurses, obstetricians, pediatricians, postgraduates, everyone, and ensuring that all the stakeholders are also part of us, coming along with us in this journey. It's a very ambitious plan, but my strength has been that we have all our partners with us and the support of the executive board and the guidance and the support of Central IAP. Thank you. I'll now stop here, and if Dr. Salima, you have a quick comment, and after this, we'll start the theme talk.
Nothing more, Dr. Shri Krishna. I think I already shared what I wanted to say, but once again, thanking each and every partner over here, because our strength is going to be the fact that we are going to be working together. So that is going to be the way that we can show Government of India and show other states how we can make a difference in breastfeeding in our state. So thank you, everyone.
Yeah, thank you, Dr. Salima. So now we move on to the theme talk, and a privilege for IAP Twin Cities branch to have whom we call as the father of BPNI amidst us today to talk about the current theme of World Breastfeeding Week, and it's a very interesting theme. And I now invite Dr. Arun Gupta sir to please take over, and sir, the floor is yours.
Thank you so much, Shri Krishna, and thank you all the participants, friends from the pediatrics, nursing, obstetrics, UNICEF. Your support to breastfeeding, your commitment and excitement is really very appreciable. And as Dr. Radhakrishnan was saying, that we have 30 years since we started celebrating. And I appreciate
Arun sir, good day, sir. Could you be a little louder? Could you be a little louder or increase your if possible?
Yes, sir. Arun sir, a little louder, and also the slides
Volume.
need to go into full screen. Thank you, Dr. Santosh, Dr. Rajeshwari, Dr. Shobha from Foxty, who will join us shortly. Request you to please stay on. After the theme talk, we'll seek your comments as well. Over to you, Dr. Arun.
Yeah. Is it okay now, voice level?
Yeah, perfect, sir. I think voice is good and we can see the full screen. Please go ahead.
Okay. So the couple of things which I wanted to share before the presentation, taking it, which I heard all the participants talking about, and just to give you an information, there are 2 hospitals in Tamil Nadu, one in Pondicherry, one in Tamil Nadu have already been certified, and 2 has been already been assessed. One is AFMC Pune, and the other one is a hospital, private hospital in Assam. So they are under analysis now. So which we do, the work we do is actually the focus is on early breastfeeding. And this week's focus is clearly on early breastfeeding. We are talking about the hospitals, right? So that's an important area which you also mentioned, that we all are here, that we are responsible, as Salim also mentioned, that it's all about us. This is a one sector intervention where early breastfeeding can improve. So the accreditation processes I would like to share with you in the principles. It is a process which helps and to induce structural changes. It is something not like a pass or a fail system that you pass or you fail or you, it's not like that. So in 18 indicators which we have framed of assessment are actually inducing structural improvement in the 20 hospitals who have already applied for. They are under the process of doing it, and they're taking months, which is okay. I mean, take 6 months, doesn't matter, but take it fully so that the changes come. So I'll certainly the action which you are saying about cesarean and all, they are appreciable because the cesarean rate is so much increasing in the country, and actually assumed that mothers cannot breastfeed. So I think we need to prove it wrong that it is a possibility. So the Global World Breastfeeding Week theme, which is Step Up for Breastfeeding, the Global Breastfeeding Collective, a joint initiative of UNICEF and WHO, has translated into take 10 steps up for breastfeeding, which means the focus on the 10 steps. So when we did our adaptation in India, so that's where we thought that we could do it. Baby friendly hospital has been now named as in India as breastfeeding friendly hospital. So this is of a screenshot from our website. The action folders in following 5 languages are available at the moment. So this is a adaptation and this is the web page of BPNI where all the materials are available, including the PowerPoint presentations and the data sheet for the state-wise data sheet for institutional deliveries and early breastfeeding. So World Breastfeeding Week, the objective of this time is basically to draw the attention of the policy makers and managers towards this particular area. And second is to encourage the hospital, which you are already on, to get into maternity hospitals with breastfeeding friendly practices, which means the 10 steps. So we recommend institutionalization of these 10 steps. So that's where the whole advocacy lies. And this is an important effort-driven area to build lactation skills, which ultimately help mothers to be successful. Now the background which early breastfeeding is, this is the first NFHS, we were 9.5. Slowly it has been increasing, but the depressing element is in last 5 years. We've gone 0.2% down actually. And in spite of the fact that our the institution deliveries have gone up. This is the national data between 4 and 5. And early breastfeeding, if not decrease, I would say it is stagnant. Now going to the Telangana state, if you see that we have a huge gap here, like this is NFHS 4 and 5, not much improvement here, a little improvement, but look at the gap here and here. So it means out of 97% who come to the hospital, as Salima put it very nicely, that we can simply say 1 out of 2 mother actually fails in the health system. So that's where we seek our own responsibility. We feel ourselves accountable to bring a change. If you don't, then the messages, communication messages, whether you give by SMS or you give by a poster, they are not helpful. That has been proven by research over ages. So for BFHI, these are the objectives, which is basically to improve early breastfeeding rate. The focus is here. Facilitate assessment and monitoring of the hospitals, to provide certification of accreditation, those who achieve those standards. We maintain a digital portal, which I'll show you in the end, and a database of the hospitals who are achieving this. And we provide technical advice as well as services to the hospitals who demand for training, for example, and certainly strengthening support to all mothers, whether they are delivering vaginally or they are delivering by cesarean section. That's an important thing because cesarean section rate has gone up considerably. If we do not address cesarean section, early breastfeeding rate, so aim should be to match early breastfeeding rate to the institutional delivery. So these are the 10 steps which a colleague from Madhya Pradesh, Dr. Nirja, translated into Hindi. And this is the global poster of 10 steps. This is the MA program's national guidance. So most of it is based on 10 steps, but we have gone to the next step, stage of revised 10 steps, which are adopted in this particular. Needless to say, this all evidence is available on the website. I will not get into the detail. That evidence for doing BFHI that it works. A little bit on the process. In 2019, we developed the tools for assessment under the Government of India as a technical advisory group chaired by the Child Health Commissioner. WHO and UNICEF and other experts took part on it. And then we tested them in Andhra Pradesh and, at that time, and we are now ready to launch it further. So in a way, we have done a strategic partnership with the Association of Healthcare Providers, which is a private hospital owners association, because the government wanted us to go to because government has MA program. So the government said, okay, you better look at the private sector. So that's why we are focusing on that, but not that government hospitals should not do it. I welcome all the government hospitals also to join. Now, these are the partners which have committed support. They are not actively supporting the work of BFHI, but they are promoting it. In a way, all of them have in writing supported this work, that this is important. So this is IAPSM, INCLEN, IAP, Technical Institute in IIT Bombay, Indian Medical Association, NNF, UNICEF, IPHA, and Epidemiological Foundation of India, PAN, and IAP Nutrition Chapter. All of these agencies have supported. Now, bit on the how do we do it? There are two steps of accreditation. The first is self-assessment, which is the internal part. It is digitally done. And after that, we provide technical guidance. So please note that this is to check the readiness of the health facility for accreditation. So what are gaps we come to know, and then we assist the hospital to bridge those gaps. And then the hospital, when the hospital is ready, then they apply for external assessment, which is based on 10 steps through 18 indicators. It is carried out by an independent assessor authorized by the BFHI National Accreditation Center. 11 interviews are conducted in the hospital, doctors, nurses, and mothers, and their observation and verification of records based on the self-assessment as well as these 18 indicators. So we have kept this is all these two processes actually ultimately deliver the findings. Based on those findings, the grading is done to hospitals. And this is something which we have kept with a total of, it costs about 17,000 on a no profit basis. So this cost has to be borne by the hospitals. So preparation needs for accreditation, I just wanted to brief you, because most of the hospitals which have done self-assessment, we find these are the areas which they are lacking. So the hospital can start. One is the data management. Most of the hospitals do not keep data on early breastfeeding, pre-lactal feeds, giving any other formula, why that was given, or a skin-to-skin contact. So this data is not given, or data on pregnancy, counseling, or breastfeeding. So that's an important point in the accreditation indicators. So we observe as well as we verify whether this is done or not. This helps in policy implementation and governance. For example, in this, the easier steps are to issue a notification. The difficult steps are, as you said, every month we will do something. Here we are indicating that there should be a committee of the hospital with an obstetrician, nurse, pediatrician, and anybody else in the administration. They meet every month to 1 to 3 months and look at this data. And once they look at the data, they find the gaps. They are together can help to bridge those gaps. So this is an important element in the 18 indicators. Then the third one is the skill training of the staff. Most of the hospitals believe that they'll do it of their own, fine, do it anyway. There are several training courses available. MA program is one of them. BPNI has a special program now in which 75% is online. This is 18 hours is online and 8 hours is a clinical practice where a trainer goes to the facility and provides clinical training to the staff. So maternity staff needs to have skills to assist mothers who has given birth via vaginal or cesarean method. This is very important because Otherwise, most of the people leave the cesarean mothers behind. So that's how these things, once they change, that's where we claim that accreditation induces structural changes. And when Shri Krishna told me about, when he was talking that we want to demonstrate a change, I think these are the indicators which will help you, this data management system, that if there are 80% now, what happened after 3 months of monitoring. So that's the kind of thing which will help in terms of demonstration also. So I think I've explained this. This is more like an application on the website, payment, conducting self-assessment, technical advice from us, and then application for external assessment. External assessor goes and that performs the assessment, submits the report. These are the processes. And then we provide a grading from 1 to 5. Hospitals which receive grade 1 get the certificate. But the hospitals which get 2 to 5, they receive support. They continue to receive the support to reach grade 1. And those who refuse to do so, we cannot help. So hospitals can reapply after preparing, and recertification is applied after 3 years. So certificate is valid up to 3 years. This is the kind of like a certificate which is issued, signed by AHPI and BPNI directors. And now so you all know about the benefits to mothers and babies. The hospital stimulates continuous improvement in the hospital actually with a benefit. It helps the hospital to demonstrate commitment. It helps the hospital staff with continuous learning and leadership. And it improves professional development of all the staff. So this is these things like the logo and others, hospitals can make use in the marketing of that we are baby breastfeeding friendly hospitals. So they can attract people who are willing to be breastfeed. So this is the web platform. If time permits, I can show you the website also. This is the brochure of the breastfeeding friendly hospital initiative. And these are our contact numbers. You can write us an email or contact us on these phone numbers. So if you have time, I can show you a couple of websites, Shri Krishna, depending.
Yes, sir. Please go ahead. You have 5 minutes.
All right. So can you see the website?
Yes, sir.
Hello?
Yes, we can.
Okay. So this is the web portal of BFHI. Here, if you say click apply, it asks for whether you are a maternity service or not. And if you say yes, then it goes to the application process where the details are gathered from the people and the contact person, so that one person is in contact with us. And then these are the steps again, they are completed stepwise. And after this confirmation, once your confirmation is done, then the payment is made and the self-assessment form appears, and then the self-assessment is done digitally. So it can be downloaded also from the website, but this is what we advise, that we should go more digitally, so that we can just a second. So this is the website. Sorry, just saw disappear again. I'll show you the other features here. How can I give this? Yeah, I was not able to remove the bar. So here one can apply to be an authorized assessor, which are independent assessors. We have 120 so far in 19 states. Here is the accreditation, the tools, the interview forms, the process, the indicators, all are mentioned here. And in here, you can see in the resources section, you can see the documentation, international and national, as well as evidence. Caesarean evidence is also here on the caesarean section. So this is the governance structure here. There is a 9-member group of governance which leads the governance process. So these are all the international and national guidance here. So just a quick, those who want to, when you do on 6th, I would like to introduce another, if you can see the website of I Decide now. Can you see?
Yes, sir.
All right. So this is for especially for obstetricians who do not have time during pregnancy period. So we have created a digital portal which helps pregnant women to register as well as learn. There are 6 videos inside the portal, and they can be helpful in educating pregnant women on all the aspects. And then they can download their certificate that I want to breastfeed, or if there is a woman who really wants to give formula, then we have that guideline for safety of formula feeding there. And then she can inform the concerned doctor also that this is my decision and I would like these services. For example, a mother who wants to give mixed feeding, she needs safety of formula in the hospital. So that's a more like a human right approach, that empowerment of women is being done. So this is an offer from BPNI. We charge, again, we have to be self-sustainable. Per registration charge is 199 rupees. So just to be transparent on that. So if anybody is interested, they can contact us. Thank you very much for your attention. I will be happy to answer any questions which you may have. And
thank you, sir. Thank you, Arun sir. And like we promised, we'll try to take this from advocacy to action and have a couple of our facilities accredited at the earliest. And all this is possible only with the support of all our partners. May I now request Dr. Basavaraj, he's the president of NNF Telangana State Chapter. Dr. Basavaraj, sir, if you're around, if you could say a few words.
Good evening. Thank you, RFE, for inviting for this event. From NNF Telangana, we are also a strong advocates for breastfeeding and being the partners. I'm sure all this is very close to all the pediatricians' heart, and we also have planned a couple of events throughout this breastfeeding week, and the common we in association with IAPTCB and IAP Telangana, we have a quiz where it's a very unique quiz where all the stakeholders in the breastfeeding who are associated are welcome to participate in it. So it's a very popular event which we have been conducting since quite a couple of years now. Even during the COVID also we had it online quiz. We continued it. So we are with you with IAP and IAPTCB in this wonderful event. Thank you, Sri Krishna, for inviting.
Thank you, sir. Thank you, Basavaraj, sir. And it's a very heartening thing that IAP and NNF would walk together and ensure that we take up this advocacy for breastfeeding through the whole week. We're also very thankful to Dr. Shobha Madam. Madam is the president of Foxtree Hyderabad chapter. And she's actually probably at a wedding now, but she has promised that she will join and convey best wishes and share her thoughts and also join us in this journey over the next 1 week. Thank you, Shobha Madam. Look forward to your remarks.
Thank you so much. Thank you for having me here to talk about the importance of breastfeeding. And I'm not here to talk about theory now. And the whole week, we have planned from Obstetric Gynae Society of Hyderabad, so many activities, especially to reach the common people And so we have already placed for competitions of slogan competitions, poster competitions. So it is not like a childhood drawing competition, but this encourages and then motivates, and all these are put up in the hospitals to just motivate our patients. And antenatally also we do encourage our patients, and then so that we prepare our patients both anatomically and psychologically, so that we do have less of breastfeeding problems after the birth. And of course, in association with pediatricians, all the time we've been doing so many programs, and so every year I'm sure this should be celebrated, and then it should reach the common people through media too, and even on the radio we've been giving our messages. And so there is nothing like this, and we have to make definitely a little hangama about the breastfeeding week and the happy breastfeeding week. And thank you once again for having me. Thank you.
Thank you, Shobha ma'am. And I'm sure when pediatricians and obstetricians work together, there's really no hurdle to improving breastfeeding rates. Thank you. I'll reach out to you further so that we partner in a couple of activities and we are able to make a big difference in this World Breastfeeding Week. Another partner, which is a very significant one, is Dr. Santosh. Dr. Santosh is the Executive Director of Sushena Foundation, and of course many other charity and NGOs which he contributes his time and efforts, and a very close friend as well. Thank you, Dr. Santosh, for joining us. Dr. Santosh is also the lone member of National Medical Council, but he is here today as on a personal invite. Thank you, Dr. Santosh. Look forward to hearing from you. Dr. Santosh, if you're around. Yes.
Very good afternoon. Is it audible?
Yes, indeed. Thank you. Thank you for joining us wherever you are. And true to your promise, you said wherever I am, I'll join in. Thank you.
Thank you, Dr. Sri Krishna and IAPTCB Twin Cities for taking up this initiative. And I'm actually driving, so I'm sorry. There might be some noise. But many, very hearty congratulations for taking forward this initiative, a very, very crucial initiative, and involving all the partners, and this 1 week whole drive on breastfeeding awareness. And most importantly, I think the BPNA accreditation that is going to happen, and the support that UNICEF is lending and IAPTCB Twin Cities branch is lending to push the BPNA accreditation is commendable. So on behalf of Sushena Health Foundation and Dhatri Mothers Milk Bank, during the breastfeeding week, we are opening a breastfeeding lounge and a milk expression lounge in ESI Medical College and also in AIIMS Bibinagar. And we are opening 2 new milk banks in Kakinada and also 1 more in Lucknow. So, I mean, on behalf of the Dhatri and Sushena family, we are in full support of these initiatives, and we would be happy to organize programs with social and preventive medicine departments, community medicine departments, public health enthusiasts, and also we are working at ground level. We have a large base of 500 Kishori Vikas Karyakartas in Hyderabad city with whom we would be organizing a program, and with nursing college students and nutrition students in various colleges we are organizing programs. So we would be very, very happy if some of the pediatricians and experts from IAP and NNF and Foxy come and speak at these events. And we are very, very thankful, and congrats Dr. Sri Krishna for organizing this and taking forward this initiative. Thank you very much.
Thank you, Dr. Santosh. A big yes for participating in any of your advocacy events, and we'll be very happy to interact with the Kishori Vikas students and also the entire team. It's a promise from IAP that one of us will definitely be there at all, if possible, events. I also take this opportunity to invite Dr. Yadaya. Dr. Yadaya is here as the project lead of Newborn QI Quality Improvement Project, and he is going to be the lead for us as we take up two important activities related to newborn. Dr. Yadaya sir, at the beginning itself, I committed on your behalf that we'll take up your unit upfront for BPNI accreditation. So whatever you speak, it's already a promise from our end that we'll do it at your place. Please request you to say a few words.
Sir, good afternoon all. IAP, UNICEF, BPNI and friends. And the lecture by Dr. Arun Gupta sir was very informative and very useful for accreditation. And coming to the accreditation, breastfeeding friendly hospitals, I think we got the SNC accreditation in 2013 way back. We didn't have any difficulty. Now after a gap of 10 years and I am again trying for the accreditation to breastfeeding friendly hospitals. And I think I have support of all you friends. I think it's not a tough. I'm sure that I will do it. And thanks for choosing Nalgonda as the Center for the Quality Improvement and the accreditation of the breastfeeding friendly hospital. Thank you so much. Thank you very much all.
Thank you, Yadai sir. It's always a pleasure. And each year you come up with a different challenge, and I'm sure we'll together, both of us will enjoy the challenge of making your unit one of the first ones to get accredited. A big thanks to Dr. Rajeshwari. Madam is the president of Trained Nursing Association of India, and Madam has been a big support for us during the time of COVID when we were able to reach out to the nurses, and she has also promised her full support for the World Breastfeeding Week. Madam, request you to say a few words.
Yes. Good afternoon, sir. Good afternoon, one and all who has been present virtually for this launch event and theme talk World Breastfeeding Week 2022, which has been organized by Indian Academy of Pediatrics, Twin Cities branch. I take this opportunity to thank Dr. Sankar Bhaskar, President, and Dr. Sri Krishna sir, Secretary of Indian Academy of Pediatrics, Twin Cities branch, for inviting me for this program. Breastfeeding Week was started to generate public awareness and support of breastfeeding. And this year theme is set up for the breastfeeding, educate and support. And nursing encompasses autonomous and collaborative care of individuals, all ages, families, groups and communities, which includes the promotion of health and prevention of illness. India currently has over 3 million registered nurses and midwives who are responsible for the country's 1.3 billion population, which is significantly less when compared to WHO norms, that is 3 nurses per 1,000 population. But still, we nurses can play a major role in educating and supporting for early initiation of breastfeeding. Through many ways, like with the time and place where the patient care is provided by helping the mother to begin breastfeeding and to enjoy it at the same time providing her infant with optimum nutrition for early growth and development by educating the mothers with the advantages of early initiation of breastfeeding, which is crucial for the baby survival as well as it's also important for the mother by preventing the infection for the baby, and also the mother is also benefited by preventing the breast cancer. So how we as a nurse we can help the mothers for initiation of breastfeeding, maybe like a prenatal nurse can be wherever she may be, in the community or in the hospital setup. She can inform or educate the mother the advantages of breastfeeding to herself and for her baby. And during the labor room, or a delivery nurse can aid the mother in her first contact with the baby and reassure the mother who has cesarean birth or a premature or a sick infant that she too can breastfeed the baby. And in the postpartum wards, the nurses can help breastfeeding to continue by providing frequent maternal and infant contact during the mother's hospital stay. A nursery nurse supports breastfeeding by refraining from giving the baby other fluids. And in the pediatric wards, the nurses can continue the helping pattern by reinforcing the statements and actions of others which will further impress the mother with the appropriateness of her infant feeding methods. At this juncture, I agree with Dr. Salima and request all the nurses, whoever is working, whichever may be the setting place, it may be a ward, labor room, or an antenatal ward, or a community health center, or a PHC or a sub-center. I wanted all the nurses to take a vote that we will educate and support the mothers for early initiation of breastfeeding. And this breastfeeding week has been celebrated by all the nursing schools and colleges to enlighten the mothers with the importance of breastfeeding to the mothers as well as their family members. Here, the family member support is also very much important to enhance or initiate the early breastfeeding. So for that reason, the students, nurses are taking so many, it may be whatever they are educating the families, the mothers, family members, and for participating in this breastfeeding week. So I once again thank Dr. Sri Krishna and his team for including TNA in this program and inviting me for this program. Thank you, sir.
Thank you, ma'am. Nurses have always been a part of our work, and we can move together as a team, the obstetricians, the nurses, pediatricians, neonatologists, and of course, big support from the community as well. Thank you. And my heartfelt thanks to all of you, all the partners, the presidents who have joined us today and committed to join IAP Twin Cities branch in this journey. Conveying regards on behalf of Dr. Vikas Bhatia. I met him a few days back and he has promised his full support, and we'll be coming out with a few technical documents with the help of AIMS BB-Nagar. And also very, very thankful to our chief guest, Dr. Ramesh Kumar sir, who has spared his time to launch the week. And I'm sure we'll make him proud by ensuring that we are not just taking up advocacy, but also converting it into action. My thanks also to Dr. Salima Bhatia, our guest of honor today, for motivating us. And Dr. Salima will ensure that it will be a week-long celebrations, which will give a big push and give the momentum required to ensure that this sustains and converts advocacy to action. Conveying thanks on behalf of our entire executive board to all our participants, and seek your support as we take up a very ambitious World Breastfeeding Week celebrations of 2022. That's all from our end. Thank you, and we'll join you again online in a couple of days for the national webinar on breastfeeding. Thank you.